I am Ted Gottlieb, Certified Senior Advisor and founder of the Senior Learning Institute. Thank you for watching this Senior Learning Institute virtual seminar on home care. You know, every year thousands of older adults choose to leave their longtime homes and move to senior living communities. Many thrive there and wish they made the move sooner. However, it seems as though a lot of folks would prefer to stay put. And if they want to do that, we want to help them. You know, in a recent survey, almost 80% of seniors said they wanted to stay in their homes, no matter their ability to do so independently. This video looks at how you can accomplish that. We're going to touch on the types of care you can receive in the comfort of your home. For this discussion, home is defined as where you're currently living, a house, a condo, an apartment, even a senior living community. If the idea is not to leave where you currently are and you want to receive the next level of care there, we can help. And this panel of experts is going to help you do that. We're lucky to have a panel of experts that really know the subject well. And I'm going to ask them to introduce themselves at this point. And we're going to start with Jay Queskin. Jay?
Hello. Thanks, Ted. Yes, my name is Jay Queskin. My company is Quest Care, and I'm a certified senior advisor specializing in care management. I got into the care management business back in 2014 after I had a specific need for parents and was learning things along the way and found out there was a lot of people out there that were overwhelmed. So I looked into becoming a certified senior advisor, became a care manager, and that's what I've been doing since 2014.
Very good. Thanks, Jay. Barb?
My name is Barb Madison, and 17 years ago, I started Right at Home of St. Louis. I'm a registered nurse and a certified geriatric care manager, and we provide private duty services that help people stay in their homes as long as they want. Our website is www.rahstl.com.
Great. Thanks, Barb. Alan?
Hello, my name is Alan Surface with Assistance Home Care. We family-owned business here in St. Louis with 5 area locations doing private duty home care and helping honor one's wishes to stay at home. More information on our company at assistancehomecare.com.
Great. Thank you much, Alan. Janie?
Hi, I'm Janie Sands, and I am the administrator of Friendship Village Home Health Care. You can find our website on the Friendship Village website, which is friendshipvillagestl.com.
Very good. Thanks, Janie. Beth?
Yes, my name is Dr. Beth Templin, and I'm a board-certified specialist in geriatric physical therapy. I am the owner of HouseFit Physical Therapy and Wellness, and we are located in South County. But we also have a mobile physical therapy team that will come and see you one-on-one in the home, and we service the majority of the St. Louis area. More information on us at housefitstl.com.
Very good. And Jenny?
Hi, my name's Jenny. I'm an occupational therapist. I recently was certified aging in place specialist last fall, and I just opened my own business, Innovative Occupational Therapy Services, providing in-home OT services. You can find more information at iots.health.
Very good. Thanks, everybody. Now, the audience probably recognizes the fact that all of these are St. Louis area run businesses. We certainly connect you locally, but we can also connect you nationally. So if you need resources outside of the St. Louis area, everybody here on the panel knows somebody somewhere, and we all have pretty deep networks. So please reach out to us, and we'll be happy to help you. Jay, we're going to start with you. You had noted that you're a care manager, and for those who are unfamiliar with the important role that care managers play, please tell us what a care manager does.
Okay, thanks, Ted. A care manager is someone who can review the whole picture of a particular situation involving the care of a senior. And what care managers do is we promote the quality of life and help to find the proper care, whether it's home care or in a community. It includes personal consultation and help with making the difficult decisions that are involved in things like health and financial and legal decisions that impact your everyday lives, and not just for the individual but for the families. We help, we manage, we assist, and we advise older adults and their families. Many of these include things like planning and advocacy. We do some limited direct care. We also help families with the responsibilities that they face. We know that things can become very overwhelming, so we understand that. We also there's a lot of things that we are not experts in, and so we have a good group of professionals that we work with. So we refer products and services that can be helpful to the individuals and their families. And there's several services we provide, and it's pretty open ended.
Right. Yeah. I see what you do as being the eyes and ears. I have parents that are out of state, and if it gets to the point where they need care, I know I can, have somebody there to oversee what's going on, go to doctor's appointments and things along those lines. I think it's a really critical role. Help us understand, Jay, walk us through the process of determining a best care plan. Where do you even start to, figure that out?
Care plans are pretty important, whether they're done individually or with the assistance of a care manager. It's important to assess really the current, I think probably the most important thing is to start assessing the current medical and mental conditions that of the person you're dealing with, and is the conditions progressive? That's very important for where they're going to be placed, or if and how they get assistance. It's important to review their activities of daily living, and these include bathing and toileting and dressing and their mobility issues and how they transfer. Eating is extremely important, and then there's also those things that are called instrumental activities of daily living, and those are things that are also extremely important to the individual, and that includes shopping and housekeeping and meal preparation. Home maintenance is important, and transportation and how they take care of their home needs. The other thing is to take a look at medications and kind of do a medication review, and if there needs to be an expert involved, whether it's a doctor or a pharmaceutical expert involved in assisting with getting the medicines together and trying to determine if they're being taken properly at the proper times. These are all very important things. You also want to review legal legal documents and their financial needs, because this affects a lot of things that they do. Or the legal documents, first of all, are they present? Do they have any type of legal documents? And do they have a revised, or do they need to revise a power of attorney? And that's for a power of attorney, both financial and a healthcare power of attorney. Is there advanced directives in place? Those are important. And really, when you look at the current financial situation, you may want to bring a certified financial planner in to do, and maybe they have their own, to do a financial review, or to overlook their current portfolio and see what their financial needs are. It may involve the long-term care policy that you have to look into. Which is extremely important, as well as maybe they have VA benefits, pensions, things like that will also help. And probably, go ahead, I'm sorry.
I was going to say, so there's a lot going on here that
Yes.
I think what we find is that, especially if we're going through this the first time with a parent or a loved one, that we don't know what we don't know. And having somebody like you in place is going to save us a lot of time and aggravation, and would be money well spent. Let me ask you this. I mean, so once the plan is drawn up, is your job done? Are you kind of in the background?
It sometimes is, but we would prefer, and I think most of my clients prefer, that it isn't done after one shot or putting a care plan together. A lot of times things change. Well, every time things change, and a person's condition changes. So as the needs change, then it's a good idea to have a care manager in place, and use the care manager as an important tool. Many times this includes ongoing advocacy to help with the family and communicate with other professionals out there. Things can change in health and in financial needs. So these are the things that a care manager can step up and make some recommendations throughout this process.
Got it. So I'm known to ask the tough questions, and everybody knows everybody wants to know what this is going to cost. So give us a range in regard to what care management services cost, and is it ever taken care of or paid for by insurance, long-term care insurance, and things like that?
Mm-hmm. Normally, long-term care insurance doesn't take care of it, but that is changing, and I would expect it is determined by the policy, and I would talk to your long-term care agent and make that determination. I would help somebody with that. The prices range anywhere from $75 an hour up to $150 an hour. Now that seems like quite a range, and it seems like, but there's a lot that can be done in an hour. And sometimes, depending on what is needed, sometimes there's just a flat rate being given. For example, if you just need a care plan, many of us will just determine a price that it will take for that initial care plan.
Right. And I have to think the bigger question often becomes, what's it going to cost me if I don't have this type of support? Because it can get very expensive in regard to things that you've missed, especially when it comes to the legal documents and probate and all those things that we're not thinking of because we just don't know what we don't know. So, all right. Well, thank you for that, Jay. And you're going to hang with us and certainly add to the conversation. I want to move on and talk about the fact that when it comes to care, there's really two levels of care that we're focusing on and that we're going to be discussing here. The first is what's commonly known as home care. The other is known as home health. And though they sound the same, they're not. And we're going to ask Barb to step in here. And Barb, help us figure out what's a good way for us to understand the difference between home care and home health.
Thanks, Ted. Well, a lot of people struggle with this because, of course, the two terms, the two names, home health, home care, are very similar, and people use them interchangeably all the time. And we're going to look at both of those and from three different aspects, essentially, and that is who pays for the care, what kind of services are included in each of the care categories, and how you access that care. And that we'll talk about them separately because I don't want to compare them side to side because then it gets even more confusing. But the way I've always remembered, probably from nursing school, home health is paid for by your health insurance. So there's a connection. If you can remember that home health is paid for by health care, home care is paid out of your home account. That's one way to distinguish the two different types of services. The good news about both of these kinds of services is that they aren't in competition with one another, and you can and often will need to have both types of services in place at the same time. If you require home health services and but you need additional support or help outside of what Medicare is providing or what your health insurance company is providing in home care, you can have in home health, you can get home care supplemented to make sure that your recovery goes really smooth. So let's look at home health first. Home health is paid for by your health insurance company if you have Anthem, Aetna, whatever kind of private insurance that you have, or if you have Medicare, that's your health insurance. Home care is a benefit of that policy, just like hospitalization and going to the doctor's office and things like that. Home care is a part of that benefit from your insurance company. So home health is designed to help restore people, restore their capacities when something happens, when they have a healthcare episode. It has to be ordered by your physician because the insurance company pays for it. So it makes sense that the insurance company wants to have some say about who's receiving it and how they have access to it. It has to be ordered by a physician. It is typically limited in terms of the number of visits by either your insurance policy or the diagnosis that you're having treated. And then the other thing is it is the services of professionals. professional occupational therapists, physical therapists, nurses. They come to your home and help you create a plan for, recovery if you've had a fall or if you come home from the hospital or what have you. And they're going to help you execute that plan and make sure that you can do that. So that's very different than home care. Home care is what Alan and I do, and the scope of services is huge. We cover everything from providing companionship to providing end-of-life supportive care, and privately, we also do skilled services, some skilled services with nursing. Who pays for this kind of service is you pay for it out of your own pocket, out of your rainy day money, or if you have a long-term care insurance policy, if you're lucky enough to have one of those policies, they also will pay for home care services from a private duty company according to their policy benefit triggers and what have you. And in terms of access to service, you can initiate home care services anytime you want. If you need help for a couple of weeks, you can just call, no doctor's order is needed, and you're way more in the driver's seat in terms of how much you need, how much you want, or how much you can afford.
Got it. Okay, thank you. I appreciate that. So let me ask you this, Barb. It seems as though there are a lot of home care companies out there. They're popping up everywhere. What differentiates one from the other, and what are some of the good questions to ask when interviewing companies?
There's a great list of questions, and I will provide this website. It's www.homecaremissouri.org, and they are the Missouri Alliance for Home Care. And they have a whole list of questions on the website for what you should be asking a private duty company or even a home health company before you engage their services. So, of course, the basics, background checks, references. You want to make sure that they have success in this field before you decide to hire them. I mean, whether or not they do background checks, of course, on their employees, whether or not they're bonded, their employees are bonded, insured. What is the liability to me if somebody falls and gets hurt in my home? What kind of supervision do people have that are coming to my home? How can I know that you guys in the office know what's going on with me when my caregiver is here with me? Can I request a different caregiver if the one that is sent to my home is not a good fit for me? You want to know how the company operates, and you want to know what it is. You want to know what their mission is. To any employee that you talk to at the company should be able to tell you what the company's mission is. You should interview 2 or 3 different companies, and believe me, you will click with somebody. We all charge about the same amount. There's a small range. But who it is you click with, who it is you like, is the person you're going to buy from. And you just need to figure out, does this person who's taking my information, answering my questions, am I the only thing that they're worried about right now? Or do I hear a little clicking on the computer while they're talking to me? They're, sending an email to somebody else. You're going to click with somebody. And I believe that you should go with your instincts. Our mission is improving the quality of life we serve. And every single person knows it, and every single person can tell you what it is. And we really decide everything about our company from that place. And I think it's the people that make the difference.
Oh, no question about it. Well, great. Thank you, Barb. Thanks for sharing. Alan, how about you jump in here by describing the level of training we can expect a home care company will provide its workers? Is there a minimum standard?
I wish there was, Ted. I think it's a great question that families really want to drill into as far as what level of training is provided by the home care company. And it ranges. I mean, for our company, one thing we take great pride in is we've got 2 dedicated training centers, one in South County, one in St. Charles, so that we have the ability to train our staff and our team members on all the different facets they may face. We have essentially anywhere from 12 to 20 hours of annual training that we do. That's a combination of in-services, online training. We do a lot, just like Barb, to look at, what the person's experience level is, what their history is, what they've been accustomed to working with, the type of clients, the type of illnesses that they've worked with. So we put that in their records and make sure that we're, putting the right people together that have the right skill set. Also understanding, does the company have what additional support if they do have a care professional in their home that needs assistance? How would that person get the additional assistance they need? We offer, we've got 2 full-time employees that do nothing but train our team in our client's home. They can come into our office through the training center, get that training. We also offer, certifications. What kind of ongoing training does the company provide? And really, my advice to any family is, if training really isn't at the center of the home care, that's something definitely to take note of. I think Barb, hit it on the head. It really boils down to the person. But if that person could be wonderful, but if they don't have the right skill set, somebody in that home is potentially going to get hurt.
Right. And I have to assume that training is ongoing as well.
Absolutely. Absolutely.
Right. So Barb had mentioned background checks, but before we get to that, let me ask you this. I mean, how do home care companies find their caregivers? And I guess once you find them, talk to us about what the background checks or screening process really looks like.
Great question. As far as everyone in the home care industry is looking on a continual basis for incredible, wonderful caregivers who are called to serve others. There are a lot of people say that there's a shortage of caregivers in the industry. I don't necessarily buy that. There's a plethora of caregivers. I think there are what Barb and I and others in the industry would refer to as, we're looking for the unicorns. We're looking for people that really possess an ability and a desire to serve others. And we have a set of, core characteristics that we look for in our team members, and they have to have all of them. One of the simple things that we ask all of our employees is to, are you committed to respecting yourself, your clients, and your teammates? Because if that's not happening, things just break down very quickly. And it's definitely everything that we do in this service is it takes a village to make sure that everything's happening. And I think one of the most important things, if everybody's being transparent, is I think the biggest concern is allowing somebody into your home is one of the scariest things that someone can do. And every home care company has an obligation to make sure that we are not introducing, the families we serve have enough challenges. They don't need any other challenges introduced into their home. So, going through, I would say the vast majority of companies are ensuring that all of their employees are put through the Family Care Safety Registry. And again, if you go into a hospital or a nursing home, every one of the aides are going to be put through that system. They do a really nice job. We do, on top of that, we do a federal, state, and county criminal background check. We do a 5-panel drug screen. We do employment references, personal references. We do several different behavioral tests to make sure that caregiving is in one's DNA. We do face-to-face, or in the COVID-19 times, we're doing Zoom interviews. And it's just really interesting. You have to do all the steps. And the more work that a company's doing up front is going to ensure that family gets somebody truly wonderful in their home.
That's great. And you mentioned a word that the next question was going to be insured and insurance. Are home care companies and their workers required to be insured? And tell us a little bit about.
You know what? It's interesting. What Barb mentioned earlier is that the state of Missouri is not a licensure state. So there really are no requirements of a home care company other than to provide the service that's available. So if somebody wasn't insured and bonded, I think that would be a huge red flag for any family. It's amazing. In the last 9 years, I think I've been asked one time to provide the certificate showing that we're insured and bonded and our employees walking in. I think one of the biggest opportunities for people to truly consider, and it was touched on earlier, but when a family hires someone outside of an agency and they hire somebody out of Craigslist or just, privately, when that person walks in, one of the things that Barb and I and others have is, the workman's comp. And if you hire someone privately to come into your home and heaven forbid they get hurt, I think a lot of families would say, just assume that their homeowner's insurance is going to cover that. And the biggest issue is it's not. And that 100% of that, and you could be looking at tens of thousands, if not hundreds of thousands of dollars, in medical expenses if somebody was to hurt their back. So there's a great risk for families who hire privately, even though on the surface it may appear to be less expensive. Really, there's a huge risk associated with that, especially without any supervisory visits or any training that goes with that.
Right. So I know oversight's important, and that's something that quality companies do. But I guess with technology today, there's all sorts of ways that I guess families can keep an eye on things. And the question that comes to mind for me initially is cameras. What are your thoughts, and in general with the industry? What if I say, yeah, you can come in and take care of mom or dad, but I've got cameras and I just want to make sure things are going okay. What are your thoughts on that?
It's interesting. It's a little all over the board. I think cameras are amazing. I think people should be able to pop in and, see and hear what's going on in their home or in their loved one's home. So I'm a big fan. And today the technology exists to where literally for $20, as long as you have a Wi-Fi connection, for $20, you can have the most robust camera that can zoom, that can listen, that you can talk, you can have a conversation. It's motion detector. It's just amazing what technology has done. So I would say if somebody was against having cameras or allowing the family to have cameras in the home while their employees were there, I would personally see that as a red flag.
Absolutely. I agree completely. We love cameras.
Yeah.
They protect everybody.
Yeah.
It's unfortunate, but sometimes the last person in the house is going to be the person that, if something is missing in the home or, something like that is going to be, we're often, first on the list or right up there for that kind of investigation to happen. We love when there's cameras in the home. It helps us sort out things, and I think it's great because people can see their loved ones, which is getting more and more difficult.
Right. And I think, just like when I talk with my clients about open houses and what should they take out of their homes, and typically things of value, especially small things of value that can go walking, watches and firearms and rings and whatever it's going to be. I have to think some of the advice here is to have a family member or loved one secure that before you let strangers in your house, just to make sure.
Yeah.
Mm-hmm.
Yeah.
One thing is, I think the reason of doing the background screenings is not only for our clients, but it's for our care team. Because one of the most important things for all of our employees is they want to work around people that they can trust, but also work around other people who care as much as they do.
Mm-hmm.
So it's, just everything that a company does on the background screening helps everybody involved.
Got it. All right. So, Alan, I've got one more question for you. We all want to know how much these services cost and whether it's covered by insurance. Can you give us a range in regard to what people can expect to pay for home care service?
Yeah. Essentially in St. Louis, Barb mentioned it, it's really kind of a tight band. You're looking probably anywhere from $23 to $28 an hour, assuming that you're going to have like 4 hours or more. The price could go up if you're having just somebody come out for an hour. But I think at the end of the day, that's really what someone's looking for. And as far as, how people go about paying for it, Barb mentioned before, it's, so many families in St. Louis have the resources to provide the level of support that they need to stay at home. It's called the Rainy Day Fund, and sometimes it's hard for families to see or understand that it's beginning to rain. So to take advantage of that, but whether it's, you've got the long-term care insurance that can pay for it, there's a veterans program that can provide services. On a limited basis, there are people who will do a reverse mortgage, to help pay for services. But realistically, there's so much family support. When you look at a little bit of home care goes a long way for the peace of mind for the family. And typically in St. Louis, being good St. Louis, families here, Midwest families, there's typically, anywhere from 2 to 8 kids in the family. And really, it's a fraction. If everybody just chips in and does a little, it goes a long way to support the family's wishes to stay at home.
Right. That makes all the sense. The other thing too is home equity. Home equity loans as well. If that's someone, if someone chooses to go that route. Jay, I want to go back to you for one quick question. What happens when the cost of care in the home, just far exceeds the cost of care outside of the home?
Yeah, that's quite a personal decision there that has to be made. Alan spoke about a lot of possibilities there. But the real factors include, if a person has their mind set on wanting to be in their house forever, and really a lot of that just depends on what their needs are and how their needs are changing. What has to be determined too is to get that whole picture together first and try to figure out where the finances can come from. And is there a loan needed? Is there family available? Like Alan had to say, these are all determining factors. A lot of times when I assist families in making the decision when the next step is, is it time to go from home care to a community? It really depends. Is it 24-hour care? 24-hour care at home does tend to be a pretty expensive proposition, and that's one determining factor at times. Does that cost exceed the limit that people have? There's a lot of benefits to that too, and there are some great caregivers that can be there 24 hours, but that's one of the things that needs to be determined.
Right. I find too that sometimes people just want to stay home because that's where they're comfortable and it's where they want to be. And that makes all the sense in the world. But staying home and being on your own is not always the best solution. There's loneliness that sets in. There's malnutrition. There's depression. There's all sorts of things that occur to an individual who's trying to tough it out without any support at all. And that's why I think these services are so important. Alan, let me ask you this, because you touched on the fact that going with a company, not an independent caregiver, will provide a level of insurance and liability support. But what are some of the other things that you get? And really where I'm alluding to here is your bench strength. So why don't you talk to us about how you select someone who's going to be the caregiver, and what happens if that caregiver calls out sick or is in a car accident?
And every company handles this situation differently. I think probably one of the best questions could ask, from a family is just that: what happens if, for your, family's looking for continuity. So the continuity really stems from, where are you hiring the people who are going to be coming into my home? How close are they? If they're driving great distances, we're not too far off from having white stuff come from the sky and create havoc here in St. Louis. So if somebody's driving a long way, it can create a problem. So are people recruiting locally? But what happens in that situation? Most companies, do they have the bench strength to be able to replace that person? We have, in our company, we have what we call our Care Pro Select team. And you can kind of think of it as a fire department. I have people at each one of my offices that show up with no schedule that are waiting just in case something happens, we can dispatch. We also have, through our 5 offices, we have team members that can go in and fill that void until we're able to get the replacement in. Because let's face it, people have flat tires. Their dog gets hit by a car. They've got to go to, there's things that are driving so many different factors, as Barb knows, that can take people away from arriving at their shift on time. You want to make sure you're working with a company that has the bench strength and the resources to fill those voids, because it is something, unfortunately, there's a lot of companies out there that may say something to the effect of, hey, I'm sorry, Nancy wasn't able to show up, she's sick. We won't be able to get anybody out for the next day or two. And that puts the family in a really tough situation to fill those voids that are just happening just at random.
Right.
There are some people that need to be monitored 24 hours. Others can handle, 4 hours or a waking day. Some people have to be watched overnight. So those are all determining factors also.
Right. Thanks, Jay. So if you're getting home care and you need more than 8 hours a day, odds are you're bringing in an additional care provider to give relief to the person who just spent the last 8 hours there. So you really have to have a plan in place to do that. Let me ask you this, Barb, and then I'm going to move on to Janie and take this to the next level. But at what point, Barb, is it evident that a higher level of care is needed, and meaning home health, and when that's more appropriate?
Well, so for agencies like mine and Alan's, we have nurses on staff, and we can provide wound care, IV administration, medication administration and management. And we have clients that have been on ventilators and had feeding tubes and tracheostomies, and just, we can provide a pretty high level of care. I used to have, I had a client that every time I walked into her bedroom, I thought, walking into an ICU. So that can be provided in the home. I will say that it is very expensive to do it that way. And home health is not going to come in and take over that situation and provide that kind of care, because home health is their visit-based services with, PT, OT, nursing. And we were there 24 hours a day to provide every custodial need and every medical need that they had. Most people who require that level of care, when they require nursing around the clock, and a registered nurse around the clock, are looking at facility care, because it's the only, for many people, it's the only sustainable way to manage that level of care. But for us, if it's end-of-life hospice care, we can manage a lot of situations in the home that are fairly intense medically, with highly trained nurse aides and nursing supervision.
Got it. That makes sense. Janie, I want to move on to you, and let's build on what Barb had just said, because home health does take it to a whole nother level. Why don't you share with us what services home health companies are licensed to provide? And I say the word licensed because in the state of Missouri, you have to be licensed to provide home health.
That is correct. Yes, we are able to provide medical-based personal care, nursing services, physical therapy, occupational therapy, speech therapy. We have social worker services. We have dietitian services. So there's quite a big variety of services that are available under home health care. We do an assessment. We educate the patients and the families on the physician-ordered treatments for the illness management and recovery. And then we also develop and monitor those treatment care plans in coordination with the patient, the family, and the physician.
You had mentioned medical-based personal care. Can you elaborate on that?
Sure. This is a personal care that is covered by your insurance because there is a skilled need related to your diagnosis or condition. As long as there is nursing or therapy services required in the home, a person can qualify for assistance with their personal care needs when it's identified that that patient isn't able to bathe themselves safely without the risk of fall or injury.
Okay, and now is this level of care more expensive than the home care services that Barb and Alan were sharing with us?
No, this level of care is most often covered by your insurance with little to no out-of-pocket cost to you.
Oh, wow. So Medicare, private insurance, VA benefits, how about Medicaid?
Yes, so our services are covered under, like you mentioned, Medicare, managed care HMOs, private insurance PPOs, VA medical benefits, Medicaid, and then there are some private pay situations as well.
Right. So Barb had mentioned earlier, which I find interesting, that there are instances when home care and home health are both called for, and how home health is more of a situational type thing, where home care, we're there on a more constant basis. Can you maybe elaborate on that?
You may qualify for home health care services ordered by your physician and still need that extra assistance in your home that can be provided by the home care company, such as overnight care, 24-hour care, assistance with transportation, and then any additional personal care needs. So they're definitely, the two companies definitely work in tandem very well together.
Oh, interesting. Well, thank you for sharing that. We'll come back to you in a minute. Beth, you're next. And Janie had mentioned physical therapy. It just happens to be what you are. What is the role of the physical therapist, and when does she or he enter into the picture?
Yeah, thanks. That's a great question. So I think most people think of outpatient physical therapy as something you seek out once you've had an injury or to help maybe recover from surgery. But when you do geriatric physical therapy, we actually specialize in helping people stay active and independent and keeping them living in their home as long as possible and doing the things they love to do. That's kind of our goal in life. And when you look at it, we've talked about aging in place. The number one complaint of folks 60 and older is difficulty with walking and stairs. So that becomes a huge barrier to being able to age in place. And it's the perfect place for a physical therapist to step in and help you have that skill again so that you can continue to live in your home.
Wow. And this is something that I have talked to my father about in regard to, fall risk prevention and things along those lines that I think are really, really important. And especially if the physical therapy is ordered by a physician, I have to assume it's covered in regard to an expense. Why wouldn't we want to do something, be proactive to potentially eliminate a risk in our homes?
Yeah, I mean, we get that all the time. I mean, our goal, we really specialize here in helping people 55 and older maximize their independence and fitness so that they continue to enjoy a full life. For some folks, that's absolutely improving their balance so that they have more confidence, that they can go outside, reduce their fall risk, continue to golf, continue to garden, and not give up the things they love to do. For some folks, it's improving their strength so that they continue to take out the trash, that they can bring in the groceries, they can carry the laundry up and down the stairs, and they can continue to do the day-to-day activities they need to. For some folks, it's improving their endurance so that they can walk the dog, so that they can keep up with their family, and that they can stay active in the community. Our goal is to help you live the retirement of your dreams and just improve your quality of life. And really, there's not a specific diagnosis we don't work with. There's really not anybody that wouldn't benefit from exercise to improve their activity and strengthen the weak areas. The most common things that we see are things like weakness, trouble with balance, dizziness, folks with arthritis from head to toe, neuropathy, Parkinson's, multiple sclerosis, ataxia, stroke. Even folks with mild memory loss still benefit from good structured activity so that they can maintain their independence as long as possible.
And physical therapy is available both in-home and also in, I guess, a retail or a clinical environment?
Yeah, so I actually started as a mobile practice over 3 years ago, and we see people one-on-one in their homes. But then we also wanted to be able to provide group exercise classes taught by our physical therapy team, because there are so many folks who would benefit from exercise on a regular basis that either can't afford the one-on-one or they've gone to other programs like the Y or Club Fitness and it just wasn't a good fit for them. So I actually got a 5,000 square foot gym in South County where we provide both physical therapy visits and we lead group exercise classes taught by our physical therapy team. So it's really more of a medical fitness-based model where we can really modify things to meet your needs and keep you moving and getting a good workout to stay healthy and active.
So what does someone need to do to become a physical therapist? Do I just need to watch a video and take a test?
So when I was looking at becoming a physical therapist, you could no longer get a bachelor's degree. You had to get a master's or a doctorate. And so I got my doctorate. So I have an undergraduate degree in exercise science. I went to 3 years of grad school to get my doctorate. And then I took additional testing to become board certified in geriatrics. So just like physicians can specialize, you wouldn't go see your cardiologist for something that your diabetes is having trouble with. You really want to see a therapist that specializes in aging that can really help you navigate that journey.
Right. So PT does not stand for personal trainer.
Correct.
Got it. Big difference between the two. And I just see the value. I've seen your facility in South County. It's beautiful, and the work that you do is great. So
Thank
you very
you.
much for that. Jenny, there's physical therapy and there's occupational therapy, and it took me forever to figure out what the difference was between the two. So why don't you share with me and share with us what the difference is between a physical therapist and occupational therapist, and at what point does the occupational therapist enter into the equation?
Well, the word occupation kind of refers to the job of living. So we address the skills you need to do every day to get through your life. So dressing, bathing, cooking, cleaning, and I know, Jay, you mentioned one of my favorites, IADLs. So those are your higher level skills like sweeping, taking care of your pets, going to the grocery store. So we work with people to get back to independence and the skills for the job of living. And we work together with PT. So like Beth said, she often works on endurance, balance, strength. So OT incorporates some of those things, but also we can help with modifying a task. So sometimes maybe you just need to, obviously you're working with your PT, but the skill is still not developed or unsafe. So OTs are really good at helping you find ways to adapt that task to make it safer and more accessible for you.
You know, I hear oftentimes when someone has a life event and they end up in rehab, and rehab discharges them and sends the person home, they will have an OT go and visit the home and suggest modifications. Is that accurate?
Yeah. Mm-hmm. Usually when we do a home visit, we are looking at a person's daily routine. So everything that they need to do in a day-to-day routine and different things that might impact their ability to do that. So maybe they have poor lighting, or they have some trip hazards, or the bathroom toilet seat's too low. So we usually will walk them step by step, all their daily routines, and look at different ways that their home can be adjusted to make those tasks easier or safer.
Okay, and once you see those things, it's the throw rugs, it's the lighting, it's the grab bars, it's all those things that we need to be concerned about. Once you recognize what those issues are or obstacles could be, then what do you do?
Well, there is the readiness scale. So you can have all of these recommendations, and that's peachy, but if a person is not ready to make those changes, it doesn't really do you any good. So often I will, ask the person what their goal is. So maybe they love that throw rug and it's been there since, they got married years ago. And so they're not going to move that throw rug. So it's my job to look at their goals and help develop a plan that works for them, because sometimes you don't want to change. Your home is that's what we've all been talking about. People want to stay in their home and they love their home. So sometimes my recommendation doesn't always correlate with how they see their home. And that's okay.
Yeah, and as a child of someone who keeps tripping over the throw rug that's in front of the sink that's been there forever, and I'm tripping on it, I could just imagine, and when I go visit my folks, my dad keeps hitting it every time, and I know sooner or later, of course, the dishwasher is going to be open at the time he trips. It's just a nightmare waiting to happen, but sometimes it's so challenging to get people to see beyond what's in front of them, and I think it takes a certain level of tact, which I probably don't have as much with my parents.
And sometimes you can work up to things after you develop a rapport. So sometimes I'll say, hey, I've got these strips that help your rug stick a little bit better. How about I bring them next week and you can try them? If you like them, that's great. And if not, that's okay, but let's give it a whirl. So sometimes you just have to be patient and kind of inch your way up a little bit and give them options.
Right. And sometimes, I think people vote with their pocketbooks too. And it's just, being concerned about what it's going to cost stops people from doing things that's probably in their best interest. And I don't know how best to overcome that, but it's something that I always keep in the back of my mind. Does OT need to be prescribed by a physician?
Yes. Hmm.
in order for it to be paid for. But I assume if it's not ordered, but I wanted to hire you or another OT, I could do that and pay out of pocket.
Correct. Yes.
Okay, makes sense. All right, well, before we wrap it up, does anyone want to add anything to the discussion?
One thing I'll just throw out there real quick is when we talk about PT and OT, so critically important in the home. But one thing where, home care can definitely assist. Home care cannot create the exercise plan that's recommended or prescribed, but we can definitely help incorporate that into our visits to help, that hour visit from PT and OT 2 or 3 times a week is critical. But if you can supplement or complement that with 20 minutes, maybe once or twice a day with the home care team to encourage that exercise, it goes a long way.
Great. One thing that we didn't touch on and we can touch on in another episode is, the aging in place strategies. And because there's often times when we're going to be roughing it out at home, there's lifts and all sorts of things and ramps and all sorts of things that can be done to help you stay at home longer and safer. So we'll have that discussion some other time. Anybody else have anything to add before we wrap it up?
One more thing. Like Alan was saying, if I'm working in a home with a client, often I will communicate with the in-home care provider. So if there's something that I'm seeing when I'm addressing bathing that I think, ooh, that could be done differently, I often will reach out to their in-home caregiver and communicate that.
Right. You had said before, it takes a village and it takes a team. That communication is really important. Go ahead.
I think one more thing is just to have, and it's difficult to do, to make a plan, but plans can really help because once we know what the wants are, and then we figure out what the needs, then we can all do our part to assist in whatever situation comes about. But knowing what people want and what they like to be active in, what they like to do as they age, is extremely helpful to all of us.
Yeah.
I would like to add to that as well. From a home health care standpoint, we talk a lot about coordination of care. And that doesn't just occur within our home health care group and disciplines. It also, trickles over to, when we get ready to talk about discharge planning, that's when we really start talking about, what are the patient's needs, from this point going forward. Do they need home care? Is it time to, since they're not really independent yet with their medication set up, let's talk about having home care bring in that nurse to set them up for their weekly medication pill box. And let's look at, would they benefit from going, transitioning into outpatient physical therapy, occupational therapy. Let's get those services set up before we discharge. So we are always looking at the broader picture. We don't just want to discharge that patient and now they're right back to where they were before we came in. We want to make sure that they're transitioning and being as independent as possible, but yet still have those services in place that they're going to need once we're gone.
Right. And, we have to think about other things as well. So we're living at home, we're aging in place, but how are we going to shop? How are we getting goods and services? How are we, getting back and forth to the physician's office? I mean, there's a lot of positive things about senior living that answers a lot of those questions. But if we're so intent on staying home, how are we going to deal with those issues as well? So it really, it's mind-boggling to a certain point, and that's why we're here, as the Senior Learning Institute is here, is that, we're trying to provide the information that can help save pain down the road. And we're hoping that what we're doing here, you find informative and that you'll share it with others. Along those lines, to see other videos like this or to find more information on excellent resources, you can check out the Senior Learning Institute website. That's the seniorlearninginstitute.com. So please use that as a resource. We do have some live events coming up as well, and we have a 2021 series that's going to be in 4 municipalities in the St. Louis marketplace, and all that will be on the website as those schedules are firmed up. I would like to thank the following sponsors for supporting the Senior Learning Institute seminar series and our efforts, and I'm going to just read through those really quickly. There's Friendship Village Senior Living Communities. They're in Sunset Hills in Chesterfield, Missouri. Brad Colbrecker with 101 Mobility, Sean Estep with the Estep Law Firm, Becky Belu with Lasting Impressions Home Remodeling, talk about aging in place. She's a great source for that. Jay Queskin with QuestCare, thank you, Jay, for being here. Sally and Alan Surface and their team at Assistance Home Care, Barb Madison and her team in Right at Home. Drew Ishmael from Edward Jones Financial Advisors, Eileen Lambert and her team at Oasis Senior Advisors. They help people find community when it's time. Randy Schrupp, the Medicare specialist. Rick Hingston and his team at Eureka Contracting and Roofing. Dennis Cooper, the reverse mortgage specialist at the Federal Savings Bank. And lastly, if you know a senior or a loved one who needs help or guidance, we're here to refer local qualified resources, and local being anywhere in the U.S. There are folks just like me that I know that have similar services and have great resources nationally. From care management to estate planning to selling the home in any condition, we're just a phone call or click away. As always, our services are free to the consumer. Again, thank you, panelists, for being here. For now, take care and stay safe.